Hey guys, so I'm going to talk about how I regained my my independence with my cathing, because now, as a spinal cord injury, that is going to be an issue that you're going to come across on how to cath, like when to cath, cathing options, just different things that you can use, different methods that I had gone through myself to become independent and not need other people around to assist you with that. Bowel and bladder were two things that were the most difficult for me to adapt to, and for me to be comfortable with other people assisting me. And I also wanted to talk about like the fact that, incontinence, UTI, all that stuff, it's gonna happen. Okay, so these are the steps that I took to become independent. Remember, I have been injured for 4 years, so I have experienced quite a few different methods. First one would be to teach a friend. I've taught many of my friends how to cath me, whether they're females or sometimes they're males, because sometimes you just want to go out with just your friends and not have technically a caretaker with you. So that's something that you just kind of have to get over if you're embarrassed to have other people cath you. If you want to be out and still have a social life, it's really important to just kind of let that pride down and just teach others how to do it if you can't do it yourself. We're not all low T-level spinal cord injuries where we can undress and self-cath in our chair. I haven't learned how to cath in my chair, or I should say I've never tried it. I have cath myself while I'm in bed, but cathing in the chair is just something that I didn't get to because I found another option. Teaching your friends in that case, it wouldn't really matter what kind of catheter you would use, because for me as a quad, it would be very difficult for me to use a catheter like this. I have used it, I have self-cath with it, but it was extremely difficult because of the fact that I don't have full hand function. Opening things and pushing this tube through the back to actually get it out requires me using my mouth, and that's not necessarily the most sanitized way to do it, because you don't want to get any extra bacteria in that area, because you could get a UTI. A more compact catheter would be the SpeediCath for females, and this I absolutely love these, and they're easiest for us to hold, for us quads. So basically it comes in a bag like this, or like in a container like this, where the bag has Velcro, and you open the bag and then it has this part which has like a water-based lubricant to it, which then expands into this once you pull apart the Velcro for the bag, and then it opens up to this. So then this ends up being the catheter once it's pulled from the container, and it's already pre-lubed and it's super easy. You just twist it and it comes right out. And then what I do is I would lace it between my fingers like this, and then I would use a mirror and kind of put my legs in a butterfly style, put the mirror resting on my feet, and then insert it like this. So that's the female version of the SpeediCath, which is so easy. They're so compact, and honestly, if someone has to go through a bag, if you're like going through security for like a game or something, no one even knows what they are, and it's so great. So then there's a really cool way to avoid cathing at all. Basically, it's with the Foley. It's a leg bag Foley kit. This is the bag. Then you have the insert tray kit, which comes with like the lube and the cotton swabs and gloves and stuff. There's these two tubings that you connect together. This one is the one that goes inserted into your bladder, and then this one becomes connected to this one, which then gets connected to the bag. What's really cool about wearing a leg bag is that you can wear jeans and no one noticed that it's even there. When I first started dating my now boyfriend and we were going out on dates and stuff, a way to avoid asking him to cath me, my friend Kaylee recommended, you know, wearing these bags, and I had no idea how to use them or what they even were. So then she gave me a few of these kits. They absolutely changed my independence when I went out. I would wear one of these, have it run down one of my legs, and then I would either wear a maxi dress with it, or I wore jeans, and pretty much all you do is pull up your pant leg, and you could put, you know, it sounds odd, but you then put your leg over the toilet, and you just pull the cap out and you just drain it right in the toilet, and you put the cap back in. You then pull your jean pants back down, and then you're ready to go. These actually hold a lot, so they're really good for like concerts, or if you're just going to be out all day and you know you don't want anyone to help cath you, or if you're going to a theme park or something like that. So the negative part about the leg bags is that the cords are so long and they have to be rested at the bottom of your leg that it kind of limits you from, you know, your girly attire like dresses and skirts, and you know, summertime you want to wear shorts. So what I then found is Coloplast. They have an active leg bag. It doesn't hold as much as those do, but it wraps around your thigh, and these came in handy like crazy last summer for me. I would wear these all the time with shorts, skirts. When I went to Vegas, I would have them underneath my dress, and you can't even tell. And it's basically the same concept. Inside has this tubing here, which then gets connected to the bag, and it has a lock, and you just open the lock and drain it into the toilet while you're out. And then what's also really cool about this is you can't really tell that it is a leg bag. Unlike this one, where the bag is clear and you can kind of see through and see your urine, this one is, it looks like a wrap, like if you hurt your leg and it's like wrapped up. And it's honestly awesome, like especially for beach or wherever you go, just have this underneath. And again, it doesn't hold as much, but it's great for summertime and keeps you feeling girly. What I would really recommend is going and getting the surgery that I had. I'll definitely put a link in the description bar below for you guys, but it's like a suprapubic catheter. It's basically where they reroute your bladder to connect through your belly button using either your intestines or your appendix, but in my case they used both. Connect it to your belly button so that you can cath through your belly button. In all honesty, the recovery for it is brutal. I hated being in the hospital. I was on a liquid diet, and because they did use a piece of my intestines, I had to retrain my body for my bowel programs, which, you know, is not easy and not necessarily fun. And on top of it, not being able to eat food for about a week and a half. Everyone's recovery will be different, but I had the worst recovery. I absolutely hated it. But if you can stand going through complete hell for about 2 months, then I would recommend getting it. It has completely changed my life and my independence, and it's so convenient, and I've noticed that I've gotten so many less UTIs because I am not afraid to drink while I'm out anymore. Because let's face it, we all do it. We all, as SCIs, as spinal cord injuries, we all count our fluid intake in our head and think about, okay, I drank this 16-ounce fluid drink. I'm going to have to cath in about 2 hours. What will I be doing? Is that going to interrupt what I'm doing? If I'm going to the movies, you have to go and cath before the movie. And cathing is just, it's a pain in the ass. And just to make things easier and not have to worry about pulling your pants down to cath, or, you know, filling up your Foley bag. This is just, it's just completely amazing. And I cannot find enough good things to say about this surgery. So now that I capped through my belly button, when I go and do mentoring or meet new spinal cord injuries at hospitals or you know, through social media, I get asked what my belly button, you know, looks like now. If it still looks like a normal belly button, is it larger? Is there a big hole? Does it leak? Basically, my belly button looks completely normal. In all honesty, I still have my belly ring in it, and I just kind of move my ring to the side to cap through it. With some people, your bladder will leak and it will come out through your belly button. Some people always have a bandage over it to cover it so that, you know, it doesn't get on their clothes or anything like that. I haven't really experienced too much of that. But sometimes, you know, your bladder does spasm. Another option to prevent the leaking would be to get Botox injected into your bladder, which I heard works great. Since I got that surgery done, I did need a longer catheter to reach your bladder to make sure you're emptying completely. So now I still use a SpeediCath, just like the female one, but this is the male version of it, and it's exactly the same but just longer. So the catheter does extend. Basically, this is it here, and it pulls out and then it goes to this, so it's extending, and then you extend it and it snaps to come here, and then it snaps and then it comes out and it locks into place, so then it becomes this really long catheter. Basically, you put it back in, and what I do is I just kind of push it down and then it locks through, and then just seal it. So then I just twist it. And you can do this too, you know, after you have emptied your bladder, you can cap it like this so that it doesn't spill out or get anywhere. And I know that with catheters like this one, I mean, you can keep the red cap and cap it, but if it falls out, then, you know, it's gonna spill out of the bag. What can you do? But with this one, you seal it by just twisting it, and it locks into place, and then, you know, you can empty it when you get to the toilet or when you get a chance. So that is my experience with catheters and Foleys, the leg bags and active bags, and self-cathing, and then my surgery that I had, which I highly recommend. If you guys have any questions or need any more demonstrations or have any suggestions for me myself, go ahead and leave them in the comment box below, and I will get back to you guys as soon as I can. Thank you guys for watching, and please like and subscribe to my YouTube channel. Thanks, guys. Messi, come here.